and then also the Personal Injury Attorney League. Focus on how you can think about referrals for these two members. Keep your mid open and ready to catch a new idea. In just a moment, I will post the link to the feed forward card in the chat. We want to utilize that to provide information, share information with the presenter. So when the introducer gives you something new, check a box. And when you know how you start a conversation, share the Kindle in question. Next at bat is Robert Jones with a warm up uh, for, I'm sorry, next at bat is Dr. Mike Tumminello with a warm up from Robert Jones. Robert, take it away.
All right. Dr. Mike has had his own practice as a chiropractor for over 23 years. His practice and knowledge goes beyond just his office. Dr. Mike has passed his knowledge to many others. He has trained over 13 associate doctors. He has taken over 25 interns. He has clients coming as far away as Canada and Bermuda. He founded the Tumminello Group 23 years ago. Along that time, his office has had as many as 5 doctors working within the office. He has shared with the knowledge of clinical nutrition, non-surgical spinal decompression, post-surgery chiropractic, and physical therapeutics. Not only to future chiropractors, he has and contributes to share all of his knowledge with us. May I present to you Dr. Mike.
Thank you, Robert, and thank you, everybody. Yeah, so this is one of my favorite topics. I know that kind of sounds funny, but spinal decompression has really changed the practice of many different doctors' offices of spinal care. Bulging discs, herniated discs, degenerated discs, arthritic discs. You should hear that almost every day from either fellow people that you know, your friends, your family, things like that. Um, it's a very common condition, and we're going to talk about a case today of one of the patients, and this is very common that we see, is that maybe they're just treating the symptom with medications, or they're over treating with surgeries and things like that. So Stacy is a 37-year-old school teacher, and she was as the school season started up again, she's a great nutrition person, appropriate weight. She works hard, works out hard, keeps herself in good shape. But as she's leaning over, with the students kind of leaning over their desks, she starts getting this neck pain. It's pain on the left side of her neck. So she's at home and she's taking over-the-counter painkillers and anti-inflammatories. Now, neither one of those will correct a condition, but they can sometimes relieve it enough for your body to correct the own condition. So she did that for a few weeks, then it didn't get better, it kept getting worse. So she went to see her family physician, and the family physician prescribed her a prescription, painkillers and anti-inflammatories. Again, not to correct the condition, but to give it a little bit of relief in the meantime, and it just kept getting worse. So she went to the orthopedist, or the physician sent her to the orthopedist. The orthopedist said, well, let's take some x-rays. We did the x-rays. Okay, it looks like you have a little bit of damage in there. And he recommended the anti-inflammatories, the painkillers, and physical therapy. So she did physical therapy for about 12 weeks, continues to get worse. But now the impingement in the neck is radiating into the shoulder, into the arm, down the elbow, and starting to get tingly into the hand. Okay, now we're at a more severe condition. Just like sciatica in the back or the leg that runs down the leg to the foot, when you have something radiating at this point, now you have extreme compromise on that nerve. And you can get long-term damage if not properly treated. So she does the orthopedist does an MRI, they do more physical therapy, they do more drugs, and then they get down to, okay, we recommend surgery. Now, this lady's 37 years old, in terrific shape. She's got a long life ahead of her, God bless her. Surgery at that point, there's going to be long-term effects to this. And it may relieve the pain for a short time, but over long term, there's going to be complications. So treating with drugs is a classic example of treating the symptom and not the cause, right? Have you ever had that experience in life where somebody's just talking about the superficial and really not getting to the cause of the issue? That's oftentimes what medication is doing. Pain relievers, muscle relaxers, anti-inflammatories, never really correcting the issue. So by the time she got into the office, We took a new set of x-rays, and you can clearly see that one vertebra was stacked on top of the other vertebra, like this. And that was causing the disc to bulge out to the side, because discs are fibrous and rubbery like ligaments and connective tissue, but they're also have a center in them, this little circle in the center there. That little center, when it pushes off to the side, you can see that where it starts to herniate out the side, and then it ends up bulging out the side and compromising that nerve, sometimes compromising the spinal cord. So when we took the x-rays, we can see clearly the misalignment ends in there, and I can also see she had some degeneration. So misalignment can be perfectly healthy vertebra, just misaligned out of structure, out of alignment. Adjustments do wonderfully for that. When it's degenerated like that, little tricky to do as a chiropractor. So with spinal decompression, the patient lays flat on the table, whether it's their neck or their lower back, and then the unit will hold either the head or the lower back, and then it gently pulls the vertebra apart like that, and it's totally painless. The patient lays there and it pulls and holds for about 45 seconds, and then it pulls a little less and squeezes the juice out of that disc. And then as it pulls it apart like that, that causes a negative pressure in the disc and starts to suck the fluid back in, and then pump it back out and pump it back in. And sometimes the patients say, well, I have an inversion table at home. An inversion table is just a one movement, and then the muscles contract around it. In this position, they're totally relaxed, so the muscles aren't involved, aren't restricting the movement, and then it pumps that disc back up. Okay, it's usually about a 10 to 15-minute treatment, give or take, of how damaged the disc is and how much inflammation there is around there. So we do the adjustment first to get it near alignment, and then we do the decompression therapy to start pumping up that disc. And after a series, in her case, it took about 12 weeks or so. Each week, the pain got less down the arm, less down the arm, less down the arm, less down the arm, until it isolated back to right where it was originally, right on the disc. So we know the outside of the nerve is healing as it's coming back towards center. And then the entire center of the disc was able to heal, and she did well. So now when she completed her series, this is a great time to do physical therapy, okay? Because physical therapy is not going to correct a misaligned vertebra, ever. No matter what people claim, never happened. I take the before and after x-rays. So now you do physical therapy that you move the structure, now you strengthen it in place. We have Dr. Myers on staff who does most of our physical therapy here, but all our doctors are qualified to do it. And that leaves it to be stable in place and prevent the future injury from occurring again and again and again. So in her case, we recommend a follow-up treatment once every about a month to 2 months, where she comes in, gets it checked, realigned, make sure it's in nice shape, make sure she's doing her exercise as well, and then she has pain-free living. So if you have any friends that are having sciatica, which is pain running down the leg from a compromised disc, pinching in there, or the disc itself, if they have arthritis in their back or their neck, if they have degenerated discs, these are all pretty much the same terminology, just different degrees and different ways of labeling it or calling it. Spinal decompression is a wonderful option for them. There's no cracking, no popping. Sometimes we don't even have to do adjustments if it's just straight. If the vertebra is straight up and down and in good shape and doesn't need to be realigned, then they just do decompression therapy. And they love it because they can relax there and the table does all the work. I'm Dr. Mike Tumminello, Spinal Decompression, and I'll have this video emailed out to the team, as well as the link on our website where there's a video that demonstrates spinal decompression therapy. Thank you, everybody.
Well done. Thank you so very much, Dr. Mike, for that information. And thank you for that wonderful